Thorax, surface anatomy. Pleura and lungs. The parietal pleura. The parietal pleura extends superiorly 3 cm above the middle of the medial third of the clavicle. The anterior border of the parietal pleura reaches the midline at the sternal angle. The left border of the parietal pleura moves away from the midline at the 4th costal cartilage. The right border of the parietal pleura moves away from the midline at the 6th costal cartilage. Both the left and the right parietal pleura cross the midclavicular line at the 8th costal cartilage. They both cross the mid-axillary line at the 10th costal cartilage. Both sides of the parietal pleura is below the medial half of the 12th rib in the costovertebral angle. These markings indicate the extent of the parietal pleura around the outer chest wall. The line of the pleural reflection on the right side passes from the back of the xiphoid to the 7th costal cartilage. Note an abdominal incision carried into the notch between the xiphoid and the right costal margin could pierce the right pleural sac and cause a pneumothorax. Note an incision here in the costovertebral angle could also enter the pleural sacs and cause a pneumothorax. The lungs. Apex of the lung. The apex of the lung rises as high as the neck of the first rib. Note this is above the clavicle and it fills the cupola of the pleural sac. The anterior borders of the lung follow the lines of pleural reflection, except that a bite, i.e. cardiac notch, is taken out of the left lung below the level of the 4th costal cartilage. Cardiac notch. The cardiac notch on the left side is produced by the heart, which bulges into the medial surface of both cavities, but more on the left. This leaves the costomediastinal recess of the left pleural sac, into which the sharp anterior edge of the lung can expand during vigorous inspiration. Otherwise, it is a potential space. Map the lower borders of the lung. The inferior margin of the right and left lung lie at the 6th rib in the midclavicular line, the 8th rib in the mid-axillary line, and the 10th rib posteriorly. The lower borders of the lung run 2 rib levels higher than the parietal pleura. This leaves the right and the left costodiaphragmatic recesses, empty gutters between the costal parietal pleura and the diaphragmatic parietal pleura, into which the lower edge of the lung can advance with deep inspiration. Oblique fissure. Outline the oblique fissure. The oblique fissure is located in the midline near the spine of T2 or the body of T4. It moves laterally in a downward direction, crossing the 4th and 5th intercostal spaces and follows the contour of the 6th rib and costal cartilage. With the arms behind the head, the medial border of the scapula lies parallel to the position of the oblique fissure. This is used as a guide to determine the surface projection of the upper and lower lobes of the lungs. Horizontal fissure. The horizontal fissure follows the contour of the 4th rib and the costal cartilage. The surface marking of the middle lobe can be located by placing your left hand between the 4th and the 6th rib on the right side. Note, the nipple lies in the 4th intercostal space. The diaphragm. The diaphragm bulges up into each pleural cavity from below, reaching as high as the 4th intercostal space on the right side and the 5th intercostal space on the left side. During deep inspiration, the diaphragm can descend by 5 to 10 centimeters, forcing abdominal structures downwards.